Welcome to Arogya PhysioTips. I am Dr. Anamika and our topic for today is Piriformis syndrome. Piriformis syndrome is a painful musculoskeletal condition in which the piriformis muscle located in the buttocks spasms and causes pain. The piriformis muscle can also irritate the sciatic nerve and causes pain, numbness and tingling along the back of the leg and into the foot. Before we proceed further, I would like to tell you the difference between piriformis syndrome, sciatica and iliotibial band syndrome, in which people find it little confusing to differentiate from what type or kind of pain they are suffering. So let us have a look at the first point of difference between these three. The first point of difference is the area of pain, areas affected by pain. In piriformis syndrome, the pain is more in the buttocks and in the hip joint rather than the lower back pain, whereas in sciatica the leg pain is more than the low back pain, whereas in IT band syndrome it is a result of the overuse and injury of the connective tissue, in which pain is more in the outer thigh and in the knee. And the next point of difference is the effect of movement. In piriformis syndrome, the pain increases after prolonged sitting, whereas in sciatica, the pain increases when you raise the affected leg, whereas in iliotibial band syndrome, repeated bending and extending of the knee irritates the nearby connective tissue and causes pain. Now let us proceed further. As I have mentioned before, it is a painful musculoskeletal condition in which the piriformis muscle spasms and causes pain. The piriformis muscle can also irritate the nearby sciatic nerve and causes pain and numbness along the back of the leg and into the foot. The piriformis muscle is a small muscle which is located deep into the buttocks behind the gluteus maximus. It starts from the lower spine and connects to the upper surface of each thigh bone or the femur and the sciatic nerve beneath it. What are the causes and symptoms of piriformis syndrome? The causes of piriformis syndrome, usually it's unknown, but we do have a few suspected causes such as muscle spasm, tightness of the muscle, swelling of the muscle and bleeding in and around the piriformis syndrome. So these are the causes. Now the symptoms are, the first symptom is dull and aching pain in the buttocks, pain while climbing stairs, pain increases after prolonged sitting, then decreased range of motion of the hip joint. Usually the symptoms of piriformis muscle becomes worsened after prolonged sitting, running and walking, and one feels better after lying down on the back. So these are the causes and symptoms of piriformis syndrome. Now I will show you the piriformis test, which you can perform it at home by yourself if you feel that you have such kind of pain. You need to sit upright in a chair, sit straight and bend the affected leg keeping the ankle on the knee of the unaffected leg. Keep one hand on the ankle and the other on the knee and try to bend forwards. You will feel that there is a pain in the buttocks or in the piriformis area. The test is positive, then you can proceed with the exercises, and also if you are not satisfied with the test, you can visit to your nearby physiotherapist. Before proceeding with the exercises, you need to reduce the pain by applying alternate ice and heat. Before I show you the exercises, please subscribe to our channel Arogya PhysioTips and share the videos with your friends and family. Showing you 5 stretching exercises and 5 strengthening exercises. The first one which I am going to start is the stretching exercises. It's called seated piriformis stretch. You have to sit in a chair, sit upright with the spine straight and bend the affected leg, keeping the ankle on top of the knee of the unaffected leg. Keep one hand on the ankle and one hand on the knee and try to bend forwards as much as you can till you get the stretch, and try to hold this stretch for 30 seconds and come back to the starting position. Hold the stretch for 20 to 30 seconds and repeat it for 2 to 3 times. The exercise is a supine pyriformis stretch. Lie down on your back and bend the affected knee and keep the ankle on the knee of the unaffected leg. Then try to grab your thigh and pull it towards your chest and hold for 30 seconds and relax. Now the next stretch is Supine Pyriformis side stretch. Keep the unaffected hip straight and the affected leg bend and cross it towards the unaffected knee and try to stretch it as much as you can. Hold the stretch for 20 to 30 seconds and try to do it 2 to 3 times. Sit with one leg straight and the other leg crossed over your knee. Pull the raised leg towards your opposite shoulder while keeping your back straight and your shoulders facing forward. Hold the stretch position for a minimum of 20 seconds and repeat on the opposite side. The next stretch is called the modified pigeon stretch. You need to sit, bring the affected hip forwards and the leg is 90 degree and the back leg also should be 90 degree. Place one hand on the ankle and the other hand on the knee and try to stretch forward as much as you can till you get the stretch in the buttock area and hold it for 20 seconds. And repeat it for 2 to 3 times and come back to the starting position. Strengthening exercises, and you can do these strengthening exercises when your pain has come down to 50 to 60%. The first strengthening exercise is Clam exercise. You need to lie down on your side, on your unaffected side, and the affected side should be on the top. Bend your knees 90 degrees and tighten your core and lift the affected knee and hold for 20 seconds. You should lift as much as you can and as far as you are comfortable with and come back to the starting position. The second strengthening exercise is the side SLR. You need to lie down on the unaffected side and the affected side should be on top. Then try to lift the affected side as much as you can and hold for 10 seconds and repeat as much as you are comfortable and bring it back to the starting position. The next strengthening exercise is bridging. Lie down on your back, hands by your side, then bend your knees as you can see and tighten your core and buttocks and lift the hip up and hold for 10 to 20 seconds and repeat as much as you can and come back to the starting position. Strengthening exercise is the hip extension. Be on all your fours and lift the affected hip and bend your leg 90 degree towards the ceiling and again hold for 20 seconds and do as much as you are comfortable and come back to the starting position. Again you can repeat with the other leg and come back. With all these strengthening exercises, you can proceed to the resistance band exercise. As you can see here, you can tie one end of the band in your ankle and the other end to a stable object and try to take the affected side outwards and hold it for 20 seconds. You can take the support as you can see and bring it back. And again you can repeat it as much as you can. You can try the self-myofascial release with a foam roller, and we also have a video about the foam roller and we will be mentioning it in the description box. And here I will be showing you how to do it. You can perform by using a smooth surface foam roller like we have here. You can try first with the knees bent and the feet flat on the ground and support your weight by keeping your hands behind you and roll back and forth. And once you are comfortable with this, you can bend the affected hip and again roll back and forth and repeat it till the pain subsides. As we have come to an end of our topic, I would like to tell you a few do's and don'ts. Avoid exercising on uneven surfaces and on the hills. Avoid doing activities or exercises which increases the pain. Then take long breaks and walk and try to stretch if you have to sit for a long time, such as doing system work or driving. Then the last one is when you are sitting in a chair or a sofa, try to keep a thin towel or a cushion on the affected area. This will help to reduce the pain and also the spasm. Now I am signing off. So before I go, please do subscribe to our channel. Please.